I'm very, I would say, mind blown and impressed with what these compounds can do as part of a larger context of some type of therapy. And there are a lot of different approaches to this.
Mm-hmm.
And the westernized version of like neo-shamanic practices is very different from what they actually do, in whether it be the Amazon or Africa or fill in the blank, right? Like the practices are very different, or the Maztecs in Mexico, etc. So I would say I'm very impressed, and I'm also very conservative. And the vast majority of people who come to me and they're like, yeah, I really want to do psychedelics, I talk them out of it, not into it.
Really?
Yeah, the vast majority. I talk out of it. Which is not to say I think the risks outweigh the benefits, but there are certain people. If you have a family history of schizophrenia or borderline personality disorder, I do not recommend using these things. Which is another reason why I'm so excited about the different types of brain stimulation or vagus nerve stimulation. Or this is another one actually that I'll throw out there, metabolic psychiatry, using diet, the ketogenic diet specifically. There's a associate professor, I think he's still an associate professor at Harvard, named Chris Palmer, who has looked at this very extensively for certain, let's call it, people aren't going to like this, some folks, but chaotic psychiatric disorders. So let's just say there's a river and you can swim in the middle. That's like complete normalcy. That's pretty much no one. And then on one side you have hyperrigidity, let's just say, which is like OCD, depression, chronic anxiety, anorexia nervosa, which are all characterized in a sense by a certain looping and rigidity, which is part of the reason why I think psychedelics are mysteriously effective for this constellation of seemingly different diagnoses, right? They're on this rigidity side. I think classical psychedelics can be very, very helpful for that side of things. Then on the other side of the river, you've got, let's just call it a more chaotic constellation of disorders, which would include schizophrenia, borderline personality disorder. On that side of the river, it would seem that something like metabolic psychiatry is very, very interesting. You see people who have been on dozens of medications and they're on the ketogenic diet for 4 weeks and then they get off of all of their medications.
Are you serious?
Yeah, it is shocking. Shocking. So like the three, let's just call it current, it could get replaced, but pillars of the mental health like technology stool for me that are most interesting: ketones and metabolic psychiatry, brain stimulation or bioelectric medicine, more broadly bioelectric medicine, and then psychedelic assisted therapies. But I'm tool agnostic. Like psychedelics at the time were most interesting, most compelling because of some of the effects that you were seeing and the durability, right? With PTSD, with major depressive disorder, with alcoholism, through looks like NYU addiction, which by the way is not new. We were doing this research with LSD in like the 50s.
Were we really?
Yeah, 50s and 60s. And then once Nixon signed it off into Prohibition era, that all went away. And there were a lot of political motivations behind that. There was not a scientific reason for that. It was more politically motivated. But the point being that I'm very excited about what the future holds for psychedelic-assisted therapies. But I've been most interested in the science. Once it turns into like policy and politicking and grandstanding and befriending the right special interest groups, I have zero patience for that stuff. I just can't. I have a lot of trouble with it.